actually, and this is very important on the issue of the making and realistic empathy of the cases. Another issue is the realistic expectation, not only for the cases, but also for the doctors. We need to match expectations of each other. Another issue of the stigmatization. Unfortunately, lots of the migraine cases, especially chronic migraine cases, have very high ratio of the stigmatization. Why? Because of the associated comorbid psychiatric problem. For example, if you have a migraine attack nearly every day of the month, and if you have associated together with the migraine headache attack some anxiety, what happens to my brain? Am I have right drugs or the right management? Am I have the right doctors? Am I have the right schedule? And like that. You have some anxiety with that. And you can express this anxiety for the other person. Or genetical base, you have high ratio of the obsessive-compulsive disorders. Sometimes this is some personality, sometimes it could be a disorder. In these cases, you have to check each information again. If somebody face you, somebody observe you, she thinks that, wow, such a obsessive, nervous, and problematic person. And she also complain a headache disorders. Maybe she can produce themselves. It is true? No. It's actually, you have a big problem in your brain. Migraine is a brain disorders, not a fiction. It is a brain disorder, a complex brain disorder. And if you have chronic migraine, you have several numbers of the network disorders. And your migraine attack, your anxiety problem, your obsession, your fibromyalgia, your restless leg syndrome, your bowel problem, irritable bowel problem, for example, your atopic rhinosinusitis and like that attack is not your choice. You didn't order from a shopping center, send me a couple of kilogram headache attacks or the obsession or others. Of course, this is just a disorder. But in the population, for example, in the workplaces, nobody have no idea about what happens to your brain. For this reason, you have a very high ratio of stigmatization, underestimation, underrealization, and very, very high level of the psychological pressure in your life. You have to manage. You have to solve this problem. Please come with us. How? Do you have a button? Press here and solve all of the problems? If you have, you can do it. But you don't. You don't. And this is the main issue because, unfortunately, lots of our colleagues, our physicians, doesn't aware neurobiological origins of the comorbidities, and sometimes even our colleagues also stigmatize or blames the case. This is very important.